14.1 Introduction. One of the important applications of forensic psychology is in understanding the psychopathology of homicides. Homicides in simple terms can be described as killing of an individual by another individual. A forensic psychologist can play an important role in this context, not only to understand what a homicide is, but also to understand the concept of heinous crimes. Thus, in the present unit, we will discuss about the concepts and types of homicide and the also concept of heinous crimes. Further, the psychodiagnostics of homicides among youth and adults will also be explained. 14.2 Homicide and heinous crimes. Homicide refers to the killing of one human being by another human. The law of the land and the legal system that exists in a society make a distinction between different types of crimes and homicides, and these are punished according to the severity of the crime. In all these cases, most important aspects looked for are the intent to kill, the manner in which the killing took place and dangerousness of the killer's conduct and the circumstances that led to the killing. Some homicides are considered excusable, as when a person kills in self-defense. 14.2.1 Types of homicides. There are various types of homicide. These are discussed as follows. Intentional homicide. Intentional homicide refers to killing a person illegally and wantonly or willfully. Here the main intention of the killer is injure the person so seriously that he/she will lose his/her life or kill in such a manner the person is dead. In most cases it may be planned quite ahead in advance, but in certain cases, it may be spontaneous. This type of homicide includes assassination, custody killing, that is when the accused is in the custody of the police, he/she is killed illegally. In addition, this type of homicide include also extrajudicial killing, that is, extrajudicial execution, in which a person in an official position deliberately kills another without any legal processes. This can also be termed as arbitrary killing. It can be done by military or death squads, etc. Reckless homicide. This refers to the accidental deaths caused by, for instance, speed driving. The driver loses control and hits a pedestrian, or under the influence of heavy drinking, driving and losing control over the steering, etc. In certain cases the person who is driving a truck, gets exhausted due to long hours of driving and sleep deprived, may lose control over his driving and may hit another vehicle leading to death or severe injuries. In all these cases there is no intention to kill but happens because of reckless behavior, that is disregard for the safety of others. Violent homicide. This refers to harming or threatening a person with violence. Violent homicide covers a variety of offenses, and invariably, in almost all these cases, there is use of weapons such as knives, swords, guns, corrosive substances like acid, etc. in all cases. Provoked homicide. This occurs when an accused murders someone as a result of some provocation. The anger is of such magnitude that the person loses his normal sense of judgment of what is right and what is wrong. Provocation is a word which indicates much more than normal anger. It is something which incites immediate anger and the person loses his/her self-control, which clouds his/her reasoning power and thus may kill a person which he/she may later even regret. But by that time it is too late for any action. Homicide due to vengeance. This refers to the act of killing, harming, injuring another person by one who feels he/she has been harmed by that individual. For instance, one's loved one is killed by a person. The affected individual will swear vengeance to mitigate and destroy that individual, his/her family. 14.2.2 Theories explaining causative factors of homicide. As we have discussed homicide and heinous crimes, in the present section we will be presenting the psychopathology of homicides. In fact, there are many theories that explain homicide. When we consider psychopathology of homicide, what emerges is the very many causative factors which are distinct from each other. These are explained by various theories including hereditary and defectiveness theories, the biological theories, the mental illness theory, environmental theories and the integrated theory. As is evident, while the hereditary and defectiveness theories consider homicidal behaviors as due to biological and genetic causes, the mental deficiency theory considers homicidal behavior being due to low level of intelligence. The biological theories explain homicide include the technology-based investigation of the brain and its abnormalities, using MRI, EEG, CT scan, PET scan etc., which all provide a clear idea of the neurological and other brain abnormalities that could lead to homicidal behaviors. For instance, research evidence using these instruments has shown distinct neurological activity in individuals who have homicidal thoughts or who exhibit violent behaviors. As for the mental illness theory is concerned, it states that due to mental illness, a person may kill another. For instance, a paranoid person suffering from delusions of persecution may feel so strongly that he/she is being persecuted that he/she would kill that person whom he/she wrongly imagines to be the persecutor. Similarly, a patient suffering from schizophrenia, having auditory hallucination, would hear a voice telling him/her to go and murder someone, and he/she would do so. Thus, mental illness can lead a person to commit a murder and the court will send him/her for treatment rather than incarcerating him/her, as the person was not aware of what he/she was doing is wrong and murders because of the mental illness. The environmental theory states that the cause for the person's homicidal behavior is not within but outside the person, that is in the environment. Theories of socialization, symbolic interactionism, social ecology and social structural theory are examples of such explanation. In addition, there is also an integrated theory which combines biological, psychological and social explanations in the contribution of homicidal behavior, and this theory is termed as biopsychosocial theory. According to this theory, it is not any one factor such as biological or psychological contributing to homicidal behavior, but it is the combination of all the three factors that result in the individual's homicidal behavior. 14.2.3 Heinous crimes. In addition to various types of homicides, there are certain extremely dangerous crimes called as heinous crime. These are crimes which are described as evil or wicked. There is as such no explicit definition of what heinous crimes. According to the legal definition, heinous means enormously and shockingly evil. It is also defined as those crimes for which the minimum punishment under the Indian Penal Code is incarceration or imprisonment of minimum 7 years. Heinous crime is thus one in which a death punishment is justified from all aspects, and the murder committed in the most inhuman manner and is the rarest of rare cases. Such crimes give a blow to the collective conscience of the society. Heinous crime means murder, that is, murder with wrongful confinement, could be for extortion/robbery, murder with rape, murder with dacoity, murder using a hired professional, murder of a child less than 14 years of age. Thus, heinous crimes are those acts which are highly and disastrously violent, which is committed with total disregard of the law of the land, affecting adversely the public peace, order and public morals. 14.3 Psychodiagnostics of homicides among youth and adults. Some important statistics on homicides among youths have highlighted the serious global public health problem that includes many behaviors including bullying, physical assaults, sexual assault, and homicide. It has been stated that among persons between 10 years of age to 29 years, there have been around 2,000,000 homicides in each year globally, and homicide has been shown as a major cause of deaths each year. It is not only the killing, but also injuring persons during assault necessitating hospitalization are all some of the negative consequences obtained by youth homicides and violence. Youth violence causes increased health care requirements as many get hospitalized, as well as reduces productivity. Youth is the most productive age, and their indulgence in violence not only destroys all aspects of the society but renders even the youths totally useless and renders them to be a burden on society. Thus, it is important to develop certain intervention strategies that can be used in order to prevent homicides among youth and adults. But in order to do, we need to focus on the psychodiagnostics of homicide, that is, why the individual committed the homicide. What was the motive? What are the risk factors, and so on. Once the psychodiagnostics of homicide among the youth and adult is carried out, a picture could emerge that displays a way in which homicide can be prevented. Some of the important risk factors within the youths that contribute to violence and homicide among them include conduct disorder, drug and alcohol abuse, school failure, unemployment, violence in the youngster's family, etc. Certain risk factors are associated with relatives, family, intimate partners and friends of the youths, which all may involve poor monitoring and supervision by parents, lack of attachment to parents, parental depression and delinquent peers. In quite a few cases, the community could also contribute to youth violence and homicide, as for example, the community may have gangs and illicit drug suppliers, poverty in the community, misuse of dangerous weapons, etc. Focusing and assessing these risks can not only help us understand the nature and causes of homicide, but could also help us in developing suitable intervention program to prevent homicides. The problem of the identity of the offenders of the homicide is among the most relevant in the criminal psychology and has a particular place of a worldwide scale in the theory of criminal personality. The scientific interest is oriented to the process of formation of the individual and the disclosure of the worst factors of criminality that influence its formation process. The future risk of violent behavior is important from a legal prospect. In practice, predicting the likelihood of future violence will limit the release in society of those convicted for homicide. The process of diagnosis is similar to that of any other field of psychology, for instance, clinical psychology. The forensic psychologists could use various methods of data collection including case history, interview method, observation, questionnaire, psychological testing, projective techniques and so on in order to collect information about family background, past experiences, mental status, personality, intelligence, emotional status and behavior and so on of the individual who has committed the homicide. Once the psychodiagnostic assessment is carried out, the forensic psychologists could prepare a report that will provide results about the diagnosis as well as suggestions for therapy/intervention. Based on the diagnosis, various intervention strategies can be developed at societal, community and governmental levels. Interventions could focus on helping the youth and adults develop life skills, measures to prevent violence in schools, parental support for training them in positive parenting approach, therapeutic approach for youths at high risk and prone to violence, reducing accessibility to alcohol and drugs, measures to reduce poverty and problem-oriented policing. In fact, all these measures have to be taken up in combination and comprehensively, which alone would reduce violence and homicide among youths. Mode deactivation therapy is one of the better methods of treatment and rehabilitation of these aggressive, oppositional defiant youngsters. When this therapy is combined with cognitive behavior therapy, or dialectical behavior therapy, or even acceptance and commitment therapy. It helps to deal with many specific challenging problems manifested by the aggressive youngsters. It helps preventing them from progressing to serious murders like serial crime, etc. This is an evidence-based treatment program, which is very effective to treat these extremely difficult to manage youngsters, especially those who suffer from PTSD, anxiety, and depression in addition to uncontrollable aggression. They are made to see the alternative to their antisocial core beliefs and equips them with skills to gain control over their impulses, emotions and oppositional defiant dispositions. The World Health Organization, WHO, recognizing the youth homicide and violence problems, has recommended certain initiatives to be taken that include violence prevention programs in schools, collecting information on type and scope of violence in different settings, guidance to member states to prevent youth violence and strengthen response to it, support national efforts to prevent violence in youths, collaboration with international agencies to prevent youth homicides and violence, contributing to Safe to Learn campaigns to prevent violence in schools. 14.4 Let us sum up. In the present unit, we mainly discussed about the psychopathology of homicides. Firstly, the concepts of homicide and heinous crimes was explained. Homicide refers to the killing of one human being by another human. Types of homicides and theories explaining causative factors of homicide were also discussed in the present unit. With reference to heinous crime, according to the legal definition, heinous means enormously and shockingly evil. It is also defined as those crimes for which the minimum punishment under the Indian Penal Code is incarceration or imprisonment of minimum 7 years. Heinous crime is thus one in which a death punishment is justified from all aspects, and the murder committed in the most inhuman manner, and is the rarest of rare cases. Such crimes give a blow to the collective conscience of the society. The unit also discussed about the psychodiagnostics of homicides among youth and adults.